Members, when I look at the health and human issue, it comes to me that Health and Human Services is truly the tail that wags the dog of government. It is the cost driver of the federal government, the state government, and again, in Minnesota and at the federal level, when we hear things like, we're going to cut hospitals, we're going to cut nursing homes, what exactly we're doing, members, let's be visible and honest, we're cutting the places that hurt the citizens the most while expanding other areas. You know, we never seem to go backwards in these entitlement programs, and I just wrote down 3 areas that we could reform and we could have money to actually pay our hospitals and pay the nursing homes better. And one, members, is to reform the Social Security Title 4D. The child support services, if we paid only the parents that qualify for public assistance, if they were the only ones that could collect money out of Title 4D, the amount of savings would be approximately $258 million. You know, citizens out there think that the only people that qualify are people that qualify for public assistance, but that is not true. Another idea is, members, there's 3 different child care assistance programs. We could merge those. The efficiencies would net us about $21 million. The third thing we could do this year is hold MFIP and DWP grants to our 2008-2009 levels. That would net us about $58 million. Now, I know, members, when we talk here, you know, 50 million here, 50 million there, we add up to real money. Well, it is real money, and it's real people that we can cover, and we can do good things. We don't need to cover everybody with everything, and there is room for efficiencies, and there is room to change things. And the final thing I'd really like to get people to think about is that, you know, government cannot change people with welfare. The government can give you some money, but the government cannot change your life. It can only addict you to money, addict you to an entitlement program. Members, back in the 60s, the federal government, the state government started taking this money away from people, giving it to entitlement programs when it was our churches out there in society and a lot of other nonprofit organizations that took care of things like this. And we need to allow them to connect with people where they can build into people's lives, where they can actually make a difference in the life instead of sending people a check or covering their medical. That never makes a long-term difference in people's lives. And the furthest thing from what we need to do is when we take the economic stimulus money, members, we are bound to no structural changes. At a time when we desperately need structural change, by accepting the stimulus money, we are saying we have to do the status quo, and in the tails, it costs us a fortune. It spends us out into the future with no reimbursement from the federal government in the future. This is a bad thing to even accept that money.